In this video, I'm going to be talking about weeks 37 and 38 of pregnancy. At week 37, your baby is the size of a canary melon, and your baby is starting to do what we call practice their chest wall movements, because at this moment in time, they're not actually actively breathing for themselves. All of their oxygenated blood is coming via the placenta through their cord, but their lungs are fully developed, and their lungs have developed what we call a liquid called surfactant, and that is something that your baby will require once they're born and they're breathing for themselves. That helps to keep the lungs inflated so that they can just breathe in and out with ease. Now, during these stages, it's likely that you're just starting to feel very, very uncomfortable, very drained, just tired, ready for your baby to arrive. You're maybe not sleeping as much as you'd like to. When you are sleeping, as you know, it's advisable that you continue to try and lie on your left side. So try to use a supportive pregnancy pillow down your lower back and along the line of your back. So if you were to roll over during your sleep, you'll still be slightly semi-recumbent, so you'll still be slightly over onto your left side and not completely flat on your back. If you do wake up and you find that you are, the advice is that you just roll back over onto your left side and try and fall back to sleep as best you can. Week 38, your baby is the size of a watermelon. It's at this stage as well that your baby will start to shed some of that hair that we talked about earlier. So the lanugo that covers your baby's body, that will start to be shedding away in preparation for your baby to be born. And also your baby is developing their vocal cords, because again, once your baby's born, the way that your baby will be able to communicate to you is via their cry. So their vocal cords are starting to really fully develop now at this stage. Around 38 weeks is when you may be starting to notice that you're starting to again experience Braxton Hicks contractions. So some tightenings that are painless, very irregular, not lasting very long. Just be aware of them, just keep a close eye on them, because sometimes around this stage they can start to develop into contractions. Also keep a check on any loss that you might be experiencing down below. Sometimes women can experience what we call a show, which is the mucus plug that sits within the neck of the womb all throughout your pregnancy. And it's sometimes around this stage when you've started to experience some more frequent episodes of irregular Braxton Hicks that you might start to lose bits of your show. Now that isn't uncommon, it's nothing to be worried about. It can be quite a mucousy discharge. Sometimes it has a little bit of brown staining of old blood. If you're ever concerned about any loss down below, please seek advice and speak to your midwife. Again, at this stage, it's really important that you keep a close eye on your baby's movements. Around this stage of pregnancy, it is not true that your baby's movements will reduce because your baby's ran out of room. That is not true. Your baby's movements should remain consistent, regular, day in, day out. Also, your baby will not slow their movements down because you're preparing to go into labour, so they're conserving energy. Again, that is not true. Your baby's movements should remain consistent. The sensation may have changed, but you definitely still should be feeling that regularity of pattern. So in the next video, I'm going to be talking about weeks 39 to 40. Join me in the next episode.